Within the serene yet struggling Gabassawa Local Government Area of Kano State lies Mazan Gudu Primary Health Care Center, which stands as a stark symbol of healthcare system in crisis. Mazan Gudu PHC was once a beacon of hope to the locals, but it now stands as a symbol of neglect and despair. For the residents of Mazan Gudu, healthcare comes as a steep cost, often paid with their lives. Awal Sule lives close to Mazan Gudu PHC and used to volunteer at the PHC. He was volunteering, hoping to make a difference and save lives. He has witnessed so many pregnant women dying in the community. Some are his friends and some are family. Sule told Kame TV that most times when the community needs the PHC, it turns its back on them because the facility has nothing to offer. No staff, no drugs, nothing. With meager earnings, the people of Mazan Gudu spend most of their income on healthcare, forced to turn to expensive pharmacies and patent medicine stores. The nearest functional government hospital is over 5 kilometers away, an insurmountable distance for many.
Most times, both mother and child die in the process of labor, mostly in emergencies, and unfortunately, this PHC has nothing to offer in terms of emergencies. I have poured my heart into volunteering for this PHC, giving my services freely, but each day, the situation gets worse. We have lost cherished friends and family members here. This PHC cannot provide even the basic first aid when it is needed the most. I have lost all hope that this center will ever function properly after losing a relative here. Most of us in this community have turned to traditional medicine doctors because purchasing drugs and accessing healthcare in private hospitals is a far cry. Aside the maternal and child death, the financial burden of accessing healthcare in this community is so agonizing.
During the last Ramadan, Binta Sule lost a close friend of hers. She had a fever, spent all she had on chemist, but it didn't help. One night her condition worsened and she rushed to Mazan Gudu PHC. Unfortunately, no one was present, and before rushing her to the nearest hospital, she died. Binta disclosed to Kame TV that the death was the most recent one, and she can recall more than 8 people who have died in the community because of the failing situation of the PHC. According to her, she personally spent at least 45,000 naira for proper health care, more than what she can afford. Yet, many residents have no choice.
Before we could rush my friend to a hospital in Gabassawa, she died. It was so painful because her illness started with just a fever and escalated to something else. She went to Mazan Gudu PHC several times, but the only person who works there wasn't around each time she visited, so she resorted to self-care, which cost her life. This is just one of the many women who have died in the community as a result of a non-functional healthcare center. Many women do not go for antenatal because the cost of transportation and basic medicine is too much. Coupled with the harsh economic situation of the country, many of us are surviving just by Allah's will, and we take life just as it comes. The last time I took ill, I had to travel to Kano Teaching Hospital in the city, and the money I spent was more than 45,000 naira. Not all women can afford this money, and even if they do, it definitely will be for other pressing issues in their families. As the woman leader of this community, I am using the opportunity to plead with the government to come to our aid.
In May 2023, the Kano State Assembly passed the long-awaited Free Maternal and Child Health Care Bill into law. But the state of PHCs and access to healthcare is an iron of the law that was passed. In 2019, an attempt by the federal government to serve the early primary health care centers in Nigeria was introduced through the Basic Healthcare Provision Fund, BHCPF. The intervention was thought that the savior of early primary health care centers with 948 million earmarked at the start of the project. Kano State was at the top of the list of beneficiaries. It had 381 PHCs receiving funds under the program and later expanded to 484 PHCs. Research has shown that despite getting the lion's share, the project has been faced with lots of challenges in the 4 years since its implementation started in the state. Challenges include insufficient skilled health professionals, lack of data management capacity, low community participation and awareness, poor infrastructure, and a weak financial management and accountability system. Kamet TV reached out to the Kano State Primary Healthcare Management Board on several occasions, but all efforts to get a response from the board failed. There has been phone calls and text messages, but yet no response at the time of filing this report. For the people of Mazan Gudu, resilience is a way of life. Their stories highlighted the urgent need for improved healthcare accountability and management. Mazan Gudu may be a small community, but their voices echoed a larger truth. It's time to honor their struggle with action by ensuring an accountable budget system, making sure that healthcare is a right, not a privilege. Khadija Ishaq reporting.